United Way of Central Carolinas is about to initiate a new program hoping to eliminate homelessness, and here to talk about that is Dennis Marstall. You're going to be initiating a soft launch of this program. What is a soft launch?
Soft launch is to make sure we get a system up and running to help the homeless before an official launch August 1st.
Okay.
More importantly, we are down to under 2,000 people homeless in our community. That's a 19% decrease in the last 5 years. So all these efforts have been going on from Men's Shelter, Salvation Army, all the providers is paying off, but now we're taking the next step to try to resolve the last 2,000.
Homeless Coordinated Assessment System. That's what this is.
And that means if you come to one of 5 locations, Salvation Army, Crisis Assistance, whatever other locations of those 5, you will get the same set of questions to help you understand your crisis, but get you the best resource on the first try.
Okay. This is going to be initiated on May 6th, right?
Correct.
And then you mentioned the date in which the hard launch goes on.
Yes.
Yeah. How many agencies are involved? I know you mentioned 5, but are there other houses of worship, et cetera, that are going to be helping with this program? Yeah,
well, we have the basis of the providers, those like the Hope Havens who do the drug addiction, substance abuse. So we have the providers where all those who have a crisis or homeless need go to those. But we're asking the houses of faith and general citizens, if you know of a homeless person, a homeless situation, to guide them to one of 5 locations.
Okay.
So that way they can get connected to the best resource and get their issue, crisis resolved from day one. The overall goal is August 1. HUD, we're under a federal mandate, said let's do this, but they really want us to reduce the number of people who actually enter homeless, and then if they do enter it, keep it to 30 days or less. And so we have a database, a system to track whoever comes in the system, how long that they're homeless.
I must admit that I've been skeptical when I've heard efforts we're going to end homelessness by this date, et cetera. And this has been going on, Charlotte City officials, Mecklenburg County officials, agencies such as yours. I'm not sure that skepticism was misplaced. It seems as if efforts are actually working.
They are working, but you have to keep in mind, of the 2,000 on any given night, this is some people are in the shelter, some people are under the bridges on the street, 2,000 on any given night. Of that 2,000, 200 are chronically homeless. They have substance abuse, mental health issues, whatever. And so you can break down the segments of population and get the right services based upon their need. But overall, remember, who's homeless today may not be homeless in 5 years. If you had a layoff, a medical condition that puts you into a downward spiral. So we will have homeless, but we can address the crisis now. We're better equipped, we're better structured, and this coordinated assessment will help resolve the crisis that's created homelessness. And so while you're finding, yes, we can end homelessness one crisis at a time, but that doesn't mean this crisis still won't happen in 4, 5, 10 years.
One crisis at a time. All right, Dennis, that's a great way to put it. Thanks very much for joining us.
Appreciate it.
That's our end of conversation for today. We'll be right back.